All right. Hello, everyone. Thanks for tuning into this informational webinar on the Rocky Mountain Research Evaluation and Commercialization Hub, or RMT REACH. My name is Karen Brown, and I'm a principal investigator on the RMT REACH Award, along with Dr. Erica Woodall here at the University of Montana. Today, I'm very excited to be releasing the 2024 RMT REACH Pilot Award, RFA. So as this is the first program that we'll be releasing through RMT REACH, I'll take a couple minutes to give you a little bit more background on what is RMT REACH, what is the REACH program, and what are we doing. So the REACH program is an NIH-funded program established to facilitate and accelerate the translation of academic biomedical discoveries into products that improve patient care and public health. In order to accomplish this, in the last year, the NIH funded 5 institutions across the US to create academic biomedical entrepreneurship hubs for their region. And specifically, RMT REACH and the other hubs that were funded will be providing education and training to innovators, funding opportunities like this one, the project management support to go along with the proof of concept projects that these awards are funding, expert feedback, which I'll dive into a little bit more as we walk through the funding timeline, and also just building capacity. So leveraging additional resources, kind of connecting the local ecosystem and really supplementing what NIH is doing as the seed or the initial funding into developing these hubs. So this is the third iteration, so REACH 3.0 hubs. As I said, we're one of 5 that were funded. So we'll be working with CBC Heights, led by Northwestern University, University of Maryland's Build, Gulf Coast Consortia REACH by Texas A&M, and the Mid-South REACH Hub, which is led by Vanderbilt. Along with working with these different hubs, we're working really as a consortium over the next 4 years and working directly with the National Institutes of Health institutes and centers, and very closely with the Small Business Education Entrepreneurial Development Office, or SEED office. So the various stakeholders and teams in these hubs share a very focused mission of bringing biomedical products to market that address unmet medical needs. But with that said, each of the hubs is really tasked to look at their region, understand their region, and focus on process innovation that supports our own unique ecosystem of biomedical innovators. So kind of with that in mind, drilling down to Rocky Mountain REACH, or RMT REACH, from the beginning, as we were even putting in this application over a year ago, we've wanted to develop Rocky Mountain REACH to focus on building pathways to support often overlooked biomedical innovators in traditionally under-resourced areas, such as tribal or rural communities. And our mission is to reduce the barriers and bridge the resource gap facing academic innovators across Montana, Alaska, Idaho, and Wyoming, and accelerate commercialization of health innovations that address unmet medical needs, with an emphasis on representative teams from this region and products that serve populations in rural, geographically isolated regions or marginalized communities. Our vision really for the program is to be a conduit to connect biomedical product capabilities across the region, but also to the resources that are provided by the NIH within their institutes and centers, within the SEED office. And kind of by creating that hub or that conduit to the resources, we've been partnering with the University of Washington so that we can leverage what they've built through a previous iteration of a REACH program called WeREACH, or Washington Entrepreneurial REACH, and their Institute for Translational Health Sciences, housed at UW. So with all of these different resources that we're pulling together, our hope is to elevate a region-wide pro-entrepreneurial culture among academic innovators, really set the stage and start training for this being a possibility, this being commercializing your research or getting your research not only to put you into a cycle of publishing and promotions, but also to potentially get that out into the hands of patients. We hope to drive more biomedical research capacity through RMT Reach, and play a part in some economic development across the region, to support this biomedical industry that is emerging. So I went over this in a couple slides ago, but really Rocky Mountain Reach will provide biomedical innovators with funding, project management support, the training and external resources, and then that expert feedback on projects to drive early stage technology development projects closer towards commercialization. The pilot awards are just one of the aspects of Rocky Mountain Reach, but it is what I'm here to talk about today, so we'll dive into the RFA. Okay, hopefully that gave you a good idea of what Rocky Mountain Reach is providing and the robust nature of the program, but we are very thrilled to be here announcing our research funding announcement for our inaugural RMT Reach Pilot Awards. These awards intend to support proof of concept and go-to-market strategy activities for promising health innovations using a milestone-based funding model. So the RMT Reach Pilot Awards are up to $50,000, and we do anticipate up to 4 of these projects be funded in this application cycle. We're really looking for any health innovation that just moves the needle forward on unmet patient or public health needs. We anticipate that the innovations within our applications will span the full spectrum of health outcomes, whether that be therapeutics, preventatives. We're looking at diagnostics and devices, different methods, softwares, digital health products, research tools, really anything that, like I said, moves the needle forward on unmet patient or public health needs. And just a quick note, awarded teams will be eligible to apply for an additional $50,000 through a second RFA, which we anticipate will be released later this year in the winter of 2024. With the REACH funding, we can fund up to $100,000 total per project in direct costs. So we're basically releasing the next RFA as more of a closed call for proposals, with only previously funded Rocky Mountain Reach Pilot Awards being eligible for the funding. So that second tranche of $50,000 will be called the RMT Reach Drive Awards. Like I said, this is milestone-driven funding. It's not really like a typical grant. I don't want to overemphasize this because, we really are here to work with you and work with your team on putting this project and this application together. But this is really more of an opportunity to start shifting more towards a product development mindset. So projects, because this milestone-driven funding approach that we're using, projects will be scoped out using a work plan in partnership with the Rocky Mountain Reach team to define key milestones or goals and associated activities or tasks that are required to accomplish the milestones. And the proposed budget that we'll put together with you should be linked to these milestones or the actionable activities within these milestones. And the funding will be released in a stage-gated approach rather than a typical grant where you would receive just the $50,000 upfront. Eligibility. So Rocky Mountain Reach was designed and intended to support the Institutional Development Awards states in the WWAMI region. So those would be Wyoming, Alaska, Montana, and Idaho. We do encourage that postdoctoral researchers, graduate students, undergraduate students apply. This is really open to faculty, staff, trainees. Trainees do have to have faculty sponsor. But the eligible investigators, by definition, are just are those members that are affiliated with an academic institution in Alaska, Idaho, Montana, or Wyoming. Collaborators from external institutions are eligible to apply. We ask that you partner with an eligible investigator on the project. More kind of along the lines of the technology, the project's innovation must be at pre-company or licensing stage, and the intellectual property must be owned by or otherwise assigned to an academic institution in our region. Okay, key dates in the timeline that we're looking at. So we're releasing this RFA on March 1st. The letter of intent is due on March 29th at 5:00 p.m. Mountain Time. And at that point, we will take the next couple of weeks, you'll see in that timeline, to review the letters of intent for completeness, and then send invitations to submit full applications and book discovery calls on April 12th, on Friday, April 12th. This step one is the letter of intent. So like I said, March 29th at 5:00 Mountain Time. It really is 4 questions where we want to know who the team is, what your technology is, and how it will address an unmet need. We want to know what data is available already and how the validation for your product that you're proposing to conduct with the funding will support moving it forward in the commercial development pathway. After that letter of intent stage, you'll see here with the invitation to submit a full application, we are really looking for partnering with you from that very stage of giving you feedback on the letter of intent, kind of outlining these different boot camps or workshops. And you'll see here that, the workshops are really tied to the application that you're putting together. So workshop 1 will be unmet need. We'll hold office hours to discuss what you're validating as the unmet need, and work with you on it. Market potential will be our second workshop. Intellectual property and technology transfer, developing a Rocky Mountain Reach work plan, and an opportunity to practice your pitch. And that kind of takes us through this boot camp or this series of workshops to support innovators writing the application. And the next stage is really writing the full application, which we anticipate you will do throughout the process of going through the workshops. And that's combined with a live pitch of your project to an integrated review committee, which will include the Rocky Mountain Reach Executive Committee, our leadership team, plus some advisors that we have, and our external review board, which will be made up of industry and technology experts to provide feedback on your applications. So the full application is available through the RFA. You can see all of the questions. It's broken down really into 10 sections, as you can see here: background, technology, market, competition, IP, regulatory, reimbursement, risks, team, and project plan. And like I said, we're really here to run this boot camp or run these workshops to help you answer these questions to the full application, and do the research needed and partner with you to put together a successful application, which again is due May 31st at 5:00 p.m. Like I said, we have these workshops, we have the final application, the project pitch. At that point, I just wanted to point out a couple things here. The workshops, as well as the external review board, stage. At that stage, we'll have received our scores from the external review board, and we will move applications on to review from the NIH Technology Guidance Committee. So selected applications do have an opportunity to go through this process and receive independent verification of product concept, reimbursement strategy, IP development from the NIH REACH Technology Guidance Committee, which is made up of members from the Food and Drug Administration, the National Institutes of Health, the Centers for Medicare and Medicaid Services, other payers, and the United States Patent and Trade Office. So this feedback and this independent verification, as we're calling it, is incredibly valuable for potential applicants and awardees to go through this process. It kind of sets the stage for follow-on funding when you look to do a raise or are looking to bring on other partners. Having this information is incredibly valuable. I'll go back to this. And so after we receive feedback from the NIH's Technology Guidance Committee, we'll work with our applicants to incorporate that feedback into a project plan. We do anticipate that the earliest decision will be sent out in early August, and we anticipate funding to be allocated on September 1st. So really next steps and more information about this funding opportunity is available on our website, umt.edu/RMT-REACH. The full RFA is downloadable. Please review it. On the link there, you'll also see an opportunity to book a discovery call, which is optional, but we do highly encourage that you do so. If not, and you feel like you have a good handle on the project, please feel free to just send an email with any questions. We'll have our information there. We really do want to work with you on this and give you the opportunity to put together an application that will kind of support you as you go down this pathway of commercial development or product development, whether that be kind of supporting you through this application or other gap funding applications that you have access to, supporting SBIR and STTR applications. We're really here to try to get a better sense of our ecosystem, especially in this first pilot award stage, and to not only provide funding here when we can and for top proposals here, but also, look at letters of intent or full applications and get that feedback from the NIH or get that feedback from our external review board, and potentially find ways where we can direct you to the right resource if we're not the ones. So with that, I will close out this webinar. Please reach out to us if you have any questions or would just like to get some feedback on whether or not you would be eligible to apply. We're more than happy to help. Yeah, so thank you everyone for your time, and I'm looking forward to getting this launched.